Hi guys! It's Brooks,
Jaden, and Lydia.
and for our disability we chose to do ALS. For our disability we chose ALS. ALS is a disease that causes muscles to weaken and degenerate. It also affects the nerve cells in the brain and spinal cord. Devices that already exist are wheelchairs, walkers, and life vests. The life vest is a device that helps relieve pain while making transferring the patient slightly easier. Walkers are used to help patients hold them up, and wheelchairs allow them to be mobile without having to move themselves. Our device helps the patient stand or attempt to strengthen their muscle. It helps them to sit when tired. It allows them to sit when tired or in pain. And there's also a mechanical arm attached to it to help them pick up things, and a speaking device so that they are able to communicate.
Problems that our disability poses is ALS patients are not able to move very well or speak very well, so they'll have trouble getting in and out of our assistive device unless they have a nurse who can help them into it, which all ALS patients should have a nurse or a caretaker in their home with them. Our current design, we decided to stick with the standing up version of our assistive device because there wasn't really a way we knew to shift the sitting version to the standing version easily in our prototype, so we decided to stick with the standing up version, and it leans back also, so if you want to lean back while you're standing, then you can do that, but you don't have to because there's no button you can press. Our current design was chosen because we all collectively took our ideas as parts and put them into a whole. We have parts from every person's design. We have a speaker from one of our designs, we have the reclining from one of our designs, and we have there's cushions, extra cushions on all parts of the machine, and the mechanical arm from one of our designs.
Okay, so this is our assistive device. This is in the wheelchair form, and then this is in the standing up form. Okay, the purpose of our device is to allow the patient to walk, stand, sit, and lean back with ease. It also allows the patient to pick things up with the mechanical arm and communicate with others using a speaking device.
How it displays Newton's laws. The shocks from the device will stop a patient's body from moving if they happen to come to a sudden stop. Their body wants to stay in motion, which is the law of inertia. The force on the wheelchair are in balance while it's in motion. The net force has to be greater on one side than it is on the other side while it's moving. When the device is in wheelchair form and a family member or helping aid pushes it to move forward, it will exert a force back on the person pushing it, which is Newton's third law.
Our device has two demonstrations of a simple machine. We have a wheel and axle for the wheelchair version of our device. The second demonstration of a simple machine is an inclined plane right along the arm of the device and the device itself, so the arm can stay sitting up. And that's all we have.
Our device demonstrates the forces because when they're sitting up, and they're like being pushed in the wheelchair form, there's a force going this way, and then their body puts a force equally back on it. And then also when it's sitting on the floor pushes up on the wheels, and then the wheels put an equal force back down. And this is it when it's
His body from moving.
Why are we sitting here?
I don't know. Just be like.
Okay. We haven't.
That is so a blooper.
We don't leave on a bell. We don't.